Hi everyone, we're back, and the topic for discussion is the new nurse avoiding medication errors and needle sticks. Here's Sierra. She's a new nurse. She is about to make a medication error. She's afraid to look stupid, so she's going to administer potassium IM instead of IV. I am not really sure about the right route, but I don't think it will do much harm. Oh yes, it can. You can do dreadful harm giving potassium IM. Potassium is never usually given IM. Usually it's given through the IV route or the oral route to the NG2. IV it's given in a piggyback or in IV solution. But always make sure you follow the doctor's orders, and if you're not certain, be sure to contact the pharmacy or whatever literature you have or someone with more experience and ask that person if you're uncertain of what to do. Here are some helpful pointers for the new person giving potassium. Never assume if you are uncertain. It's okay to look stupid. Yes, it is okay to look stupid for what it's worth. Remember, that's someone else's life. If you are unsure, there are resources available. For example, you may try the pharmacy, you may try your institution's policies and procedures, or like I said, you may even confer with someone else who has more experience than you do. And potassium, even under the best of conditions, can be very irritating to the veins. I've hung potassium on patients who had no allergic problems, and still they cry for their veins, and it has to be discontinued and given via another route. So be aware that potassium, when you give potassium, it is really important that you follow the correct instructions for doing so. Now, here is another person just received an order to give potassium and magnesium, but I have no idea how to give it. And what does the other nurse say? Shove it in. Well, no, that's not going to work. What really works is taking the time and trouble, even though it seems tedious, to find out the exact and correct method to give that potassium. Because remember, there's always a right and a wrong way to do things. And with potassium in particular, you want to take the time to learn. It can be irritating to the stomach, can be irritating to the veins. If given too quickly, can be fatal. And so it's really very important that the new nurse takes the time. The clinical setting, step by step, is packed with helpful information on and even the sessions at dearnurses.com on administration of IV medications. It can be of great help to you. So just take the time to go through them, and that will be of great help if you can find information for the future use. Now we're going to talk about needle sticks, and you want to do everything that you can. This is my suggestion to avoid it ever happening. You don't want to take a dirty needle and get stuck with it or cause it to happen to someone else. Here are some helpful pointers. Never use a needle disposal that is full. That is really dangerous. You're going to throw that needle in, and then whatever is sticking out gets into your finger. Never recap a used needle. Typically what happens, you just take it and dispose of it. It is dangerous recapping because you might just stick yourself while doing so. There is a code blue in the emergency room. Potassium, again, hung by MD. Why are there no labels? Which patient is receiving dopamine, which person is receiving potassium? Again, you have to be extremely careful to label IV solutions. This is a little bit from needle sticks, but it's also very important. If the needle holder is full, make sure that you do not squeeze another needle in there. Make sure you get the person responsible to lock the one that's currently full and replace it with another one. I hope you have learnt something from this. There is tons of information of the clinical setting step by step. Have a great day.